Hey guys, this is Paul. So this will be a walkthrough of the Winter 2018 DEM written portion. So what I'll be doing is basically go through each and every problem, explain why the right answers are right, the wrong answers are wrong. So let's get started. Number 1. The area in which you're attempting to obtain a manual BP is extremely loud and you're unable to hear through your stethoscope. So what do? Well, let's see letter A. Obtain a systolic blood pressure for now. So in this case, yeah, that is an option that is possibly correct. It could be done. Reason is because you don't need to use a stethoscope to obtain a systolic blood pressure. All you need is your hands and palpate the radial pulse. So that's definitely an option we can use. Let's see what else. B. Defer obtaining a blood pressure until the noise dies down. You don't want to do that. If you're supposed to get a blood pressure, just get the blood pressure. Don't be lazy and postpone it. And also, there are going to be a lot of times when we're going to have loud events, and you can't just postpone and defer obtaining a blood pressure every single time. So, again, get a systolic blood pressure, and that should be good to go. You at least have some kind of reading. So let's check out letter C. Check to ensure that your stethoscope is set to the appropriate setting. If you guys remember, stethoscopes, the diaphragm usually has two settings. One's for adults and the other one's for infants. So in that case, all you have to do is just twist the diaphragm clockwise or counterclockwise and make sure that you actually hear something from the appropriate side. So that could be potentially causing you not to hear anything through your stethoscope. So definitely check that out. C could be an answer. And D, repeat multiple times until you hear through the stethoscope. Now you can do this, right? But you shouldn't do this because it's going to take way too much time, and you don't have that kind of time on hand. So, typically if you do it once and you can't hear anything, you're probably not going to hear anything multiple times afterwards. So stick with A and C, and that's the correct answer, A and C. So number 2. You and your partner are performing the extremity lift to lift a patient onto the mega mover. You're about to lift the patient's upper torso. Before lifting, what should you ensure? Okay, so let's put this in perspective. You are at the patient's upper torso and your partner is at the feet end, all right? So let's check out A. Your partner tells you to lift on 3. Now that's wrong because you're at the head end. You should be the one telling your partner to lift on 3, not your partner. So let's leave A out of it. B, your arms are underneath the patient's armpits and the patient's armpits are crossed. Okay, or your patient's arms are crossed. That is right because that's how we practiced during week 2. That's how you're supposed to do the extremity lift. So that's definitely something that we can, and that's definitely a correct option. So C, your back is as straight as possible. Also another correct option. And that's pretty much all we have. So D sums it up. D basically, whoops. D basically says B and C only. And those are the only correct options. And again, it's not A because, remember, you're at the head end. You should be the one telling your partner when to lift and when to basically move the patient. Number 3, before having a patient who is refusing treatment and transport, sign the AMA. You must inform him or her, let's see, A, about possible medical consequences of the refusal. Yes, you definitely want to do that because the patient may not fully understand the situation. So it's up to you. It's your responsibility to try to convince that person of what's really going on. B, any emergency medical treatments indicated. So you also want to make sure you tell them what you think needs to be done for the problem. If there's a broken arm, tell them they need some certain particular treatment like splinting and x-rays and all that kind of stuff. So make sure you include that. So that's definitely a correct option too. That he or she can obtain further treatment at a hospital. That is also another correct option. Reason is, again, let's say they have a broken bones, broken forearm. If they're saying no, I don't want your treatment, I don't want to get transported, I can take care of myself, I can drive myself over there, or my friend can drive me over there. In that case, then you would explain this. Yeah, you can get that further treatment at a hospital. Whether or not you come with us, whether or not you go with an ambulance, you need to be assessed by the physician at a hospital. So you definitely want to include that. So let's see our other options. A and C only. Again, this is not going to be correct. D is not going to be correct because we agree that B is correct. So the answer is E. Alrighty. 4. Neck injuries can paralyze a patient. True. Again, you have something called a spinal cord, and if your spinal cords get damaged, you're out of luck. So they can very well paralyze a patient. 5. Your patient is a singer who tripped over some microphone wires and fell off the stage. Since most of the force was transferred to her arm, a part of her radius is protruding from her skin, but no severe bleeding is present. Okay. And no spinal damage is indicated. Alrighty, so just basically all the force got into her arm. Now, what should you do? So let's see. A. Use gauze to secure the protrusion in place. Apply a splint. Okay. A sling and swath. Assess for pulse, motor response, senses, and circulation. Alrighty. So what we see here is that you're basically hopping straight into securing the protrusion and already splinting, slinging, and swathing, and then you're checking for the PMSCs afterwards, when you should be doing it before and afterwards. So let's see B. You're assessing for pulse. Okay, so basically you're doing your PMSCs, and then you're securing it in place, slinging and swathing, and then redoing the PMSCs. That is the correct option. And again, you want to make sure you do the check the PMSCs after you sling and swath, because you don't want to be held liable for cutting circulation off and leading to an amputation or stuff like that. So you definitely don't want to do that. And since that's the correct answer, let's check out C. Assess for pulse, motor response. Okay, PMSCs. Use the gauze to secure the protrusion in place. All right. Splint. Reassess for pulse, motor response. Okay. So this is not entirely incorrect, but notice that it's missing the sling and swath. Once you have a splint on there, so basically picture this. You have, let's say, a broken forearm, and you molded a soft SAM splint, to the arm, made sure it's all nice and pretty, and that's it. You just left it there. Obviously, that's not going to do very much because the splint is literally not doing anything. So again, you'd have to sling and swath that to keep that in place and immobilize it. Alrighty. D. It says for pulse, motor response. Okay, PMSCs. And then attempt to apply traction. Okay, this is automatically wrong because you don't touch protrusions. First of all, that's a danger to you because it could be broken fragments of bone, and they could cut you and lead to a whole bunch of bloodborne pathogen issues. But also, traction's only applied to femoral injuries for the most part, but definitely not protrusions. Again, if you have any broken bones that are protruding from the skin, you secure it in place, as here, gauze to secure the protrusion, and don't do anything else. All right. So at that point, we know the whole question's wrong, or the whole option's wrong. Number 6. You arrive at a young girl alone outside the restrooms. She is wheezing and showing obvious signs of respiratory distress. A woman who appears to be her mother walks out of the restrooms and panics when she sees the girl. What's your initial treatment? Okay, so before we look at the answers, let's sort of zoom out and kind of see what these answer options are talking about. A says that you're going to give oxygen. B says you're going to give oxygen. D says you're going to give oxygen. C says that you're going to assist with their inhaler. Right? Remember, during our training session, we talked about how asthma patients are typically going to be already prescribed meter dose inhalers by their physicians. So it's important for you to always inquire before doing anything else, because if you're going to throw, slap a non-rebreather on someone's face when they have a very effective inhaler that they can just flip out and use on their own, that's going to be pretty silly. So keep that in mind. And that make sure you take that inhaler out and ask the patient or the patient's parents, if the patient's a minor, just make sure that inhaler is used, because odds are they probably have one. Alrighty, so that is the option. Next up, number 7. Which of the following is most important for you to remember when taking care of a patient who is hyperventilating? Okay. Let's jump straight to the answer here. D. There may be a severe underlying life threat that could be causing the patient to hyperventilate. Well, first of all, this is taken basically straight out of the PowerPoint. And under the key points to know, reason is that when the patient's hyperventilating, initially, before you get any kind of information about the patient from the patient or the bystanders, whoever might be around, you don't know what's going on. You only see that they're breathing really, really fast, right? So that could either mean that, yeah, there might be a panic attack. Yeah, there might be some dangerous, ominous person who caused some panic attack. But keep in mind that there could be something underlying, like internal bleeding. They could be going through shock, maybe anaphylaxis. You really have no idea just by seeing someone who's hyperventilating. So that said, you're going to have to make sure you continue your assessment, ask your questions, check the patient out, make sure you know what's going on before you just, jump to the conclusion like, yeah, they're just having a panic attack, because that might not be the case. All right? So that is the correct answer. 8. You arrive at a seated patient who You arrive at a seated patient who complains of severe chest pain. He is dyspneic and manages to tell you to go away. What should you do first? All right, so let's check out A. Tell him to sign your AMA so you can be relieved of your duties. Okay, so picture this. You're going up to your patient. Hey, bud, I'm an EMT. I'm going to help you out today. What seems to be the problem? Blah, blah, blah. And the guy turns to you and he just tells you, just go away. And then you're like, okay, here, sign this off. I'm off. Obviously, no, that's wrong, right? So let's mark that off. That's definitely not an option. B. Attempt to convince him that he needs emergency care and explain the consequences of refusal. So this is correct. The reason why this is correct is, well, I'll explain that after we go through the other options. So assess for a BP prior to assisting with nitroglycerin per OCMS BLS protocols. Okay. So this is correct. The process stated in this option is correct. You're going to make sure you check for BP before helping with nitroglycerin. But the question is, what should you do first, right? He just told you to go away. You're not going to be like, all right, let me just slap this BP cuff on you. No, that's not correct. So that's also wrong. D, administer O2. Okay, so D and E, administer O2. Picture this. You're talking to the patient tells you to go away, and you just ignore what he says and slap on oxygen on his face. That is obviously wrong, so we're going to leave D and E out also. That said, you're left with B, all right? Process of elimination, you're left with B. But, B is still correct also because you're supposed to attempt to convince them that they need emergency care and explain the consequences of refusal. That's the whole, your whole spiel before you get that AMA sign. You're not just going to get it signed like what A says before you, just to let the patient go and not have to worry about the patient, right? Make sure they know the problem and make sure they know what's going to happen if they don't get treatment, all right? 9. Rest is often very effective at reducing chest pain, granted the pain is not caused by a myocardial infarction. All right, so this is true. Reason is chest pain, right? Typically, it may just be due to exertion. It may be an elderly patient or probably an older adult. Cholesterol levels aren't very good in that particular adult. So they just need to sit down, take a couple breaths, and relax. Rest is very effective at reducing chest pain, typically, especially in your angina pectoris cases. But again, obviously, you're not going to be able to distinguish angina with the MI, right? So keep in mind, though, that rest is important. And also think of it this way. You get a patient who has a chest pain. You're going to make sure that patient sits down and rests before you check anything else, before you ask anything else. Make sure they're not standing up or not walking around. Make sure they're sitting, resting. That way, you can gauge whether or not they need further treatment. If the resting is just going to take care of the problem for them. Number 10. Security brings an ambulatory adult male. Okay, so this adult male can walk, who appears nauseous. Security then tells you that he drank a large amount of alcohol. So what do you do first? Okay, let's check letter A. Allow him to sit and rest. Okay, that's good. Assess for his level of consciousness before offering an emesis bag. Before offering an emesis bag, okay. that might be wrong. So picture this, all right? Some drunk guy comes in. You tell him, hey, all right, sit down and rest here. Hey, so could you tell me your name, blah, 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 where you are, why you're here, that kind of thing. And then he just throws up in your face. That is not going to be a good case for you, right? So that's why B is correct. You're going to allow him to sit and rest, and basically, as you're checking for his level of consciousness, right, you've already started, this is the beginning of your assessment, you're offering him an emesis bag. Reason is that he's probably going to throw up. He's nauseous, right? So having a bag to throw up in would be pretty nice for him to have, right? And that's also important. We have emesis bags on hand, and other ambulances and other standby medical companies, they have that as well, and that's what they do too, right? You're not going to let them just throw up all over their shirt. All right, and C, request ALS immediately. All right, before you might think, okay, ALS first, right? Because the NREMT sheet, you have your BSI, scene safety, etc. Then you have request ALS, that kind of thing. So let's take a look at the question here. Ambulatory adult male. If he's able to walk, right? He's able to walk, he appears, and he's nauseous. Odds are he might not need ALS immediately. It's not a critical case. You don't even know if he's completely altered. If he's able to walk, he might be A&O times 2 or 3 or 4. You may not know unless you ask, right? So don't just request ALS immediately. Now, if you have a cardiac arrest patient and you've confirmed pulse is apneic, all right, get ALS over there, right? No questions asked. But in this case, you don't know if he's going to be okay. Maybe you can just sit it out, rest for a little bit, and then he'll be fine. You really don't know, so you don't have to request ALS immediately. And D, allow him to sit and rest and administer O2 via non-rebreather. Okay, so basically picture it this way. Some drunk guy walks in, tell him to sit down, and as soon as he sits down, you slap on O2 with a non-rebreather. Obviously, not good, right? You totally forgot about your A&O. All right, you don't even know if he needs O2 in the first place. Okay, alrighty. Number 11, you arrive at a patient undergoing anaphylaxis. Okay, so this is a severe allergic reaction. It is likely that the patient or the guardian or parent of the patient will have an epinephrine autoinjector, so an EpiPen, available. Yeah, the answer is true. It is likely similar to the asthma case, right? Severe allergic reaction. Typically, they might have had this allergic reaction before, and they've been prescribed a certain auto-injector, so they would have that on hand, all right? And remember, it's likely, so it's similar to the asthma case, you would ask the patient or the guardian for that epinephrine auto-injector. That way you can use that and assist per OCMS BLS protocols. Number 12. Ushers lead you to an alert, mildly hypoglycemic patient in the coal room at the Bren. Which of the following should you not offer to this patient? Okay, first of all, mildly hypoglycemic. So not full-on symptomatic hypoglycemic, so this guy isn't gonna pass out on us just yet. So what should you not offer to this guy? Oral glucose. You should probably offer that. I mean, that's why not? I mean, it's glucose. This guy might need glucose. So sure, glucose won't harm, right? So that's an option. Orange juice is filled with sugar. So that's also an option because you need to boost their blood sugar levels, and that will do the job, right? Again, this is mildly hypoglycemic, not severe. So you don't need to stick with oral glucose. And C, Skittles, sugar. Right, same concept, right? Let's C is definitely an option we can stick with. Whoops. And okay, Coke Zero. Don't offer Coke Zero. Why? I don't know if you guys know, but Coke Zero has zero anything, right? It's not gonna spike your blood sugar. Zero sugar, carbs, that kind of thing, calories. It won't do anything. It's just carbonated soda. So, yeah, that's the answer. Don't offer this. It's not going to do very much. And let's see, B and C. Okay, we're gonna offer. We can offer these two, right? So that's why this is a wrong answer. E is wrong because we can offer B and C. And same goes with B, C, and D, right? E and F are both wrong. Number 13. It is very sunny and humid outside the Bren Center. There's a large number of graduates waiting in line. You arrive at a female teenager who has hot, flushed, red skin, right? She appears to have seized perspirations, and her respiration rate is elevated. What condition should you suspect this patient is exhibiting? Okay. Keywords here. Very sunny, humid, waiting in line, outside, okay. Hot, flushed, red skin. Okay, so immediately we're going to jump straight to the idea of, okay, this is a heat-related illness, right? So let's count this out. Ecstasy overdose. Yeah, it can lead to symptoms similar to heat-related illnesses, but you shouldn't suspect that condition given that this, the current circumstances, sunny, humid, hot, outside, that kind of thing. All right. So let's see. A, heat exhaustion. No, because they're not. If you're only exhibiting heat exhaustion, you're still going to be able to perspire. All right, you're still going to be able to sweat. So leave that out. Severe menstruation. No. All right. We never covered this, and just no. That's not correct. You won't see these signs and symptoms in severe menstruation. All right. So just leave that out. C. Okay, we already counted C out. And D, heat cramps is basically a lower caliber form of heat exhaustion, so we're going to leave that out. We're left with heat stroke. In heat stroke differs from heat exhaustion in that you have seized perspirations. And typically, respiration rate is elevated. You might have elevated respiration rate regardless in any kind of heat-related illness because they might have been, doing some kind of physical activity in some sports or whatever. So that's not really a distinguishing factor, but seized perspirations is, right? And that's commonly found in your heat stroke. Number 14. The first aid room is located. A, beside the athletic training room? No, because the athletic training room is on the arena level. B, on the arena level. It's not on the arena level, all right? Refer to the map in the PowerPoint that we showed you guys. C, to the left of the main office. It is not to the left of the main office. The left of the main office is the northeast exits, right? The exits out to the trees and the roads and all that kind of stuff. And D, on the concourse level. That is correct. It is on the concourse, or you can say second level. And E, beside the double doors holding to the loading bay. Remember, loading bay is on the arena level. Automatically incorrect. So we're left with D. Easy question. Granted that you looked at the PowerPoint. Number 15. There are or is blank number of AEDs at the Bren Event Center. The turnaround is on the blank level, whereas the loading bay is on the blank level. Okay. So first of all, there are two AEDs, all right? One on the top floor, one on the bottom floor, okay? The turnaround is on the concourse level because the turnaround is basically attached to Mesa Road, all right? Refer to the PowerPoint if you're confused about what I'm talking about. But and also the loading bay is on the arena level. Remember, the loading bay is basically right behind the basketball court on the bottom, or the arena on the bottom. It's basically that fire zone lane out there with the giant doors. But remember, it's on the bottom level, the arena level. Number 16. You're treating a trauma patient on the arena level. You and your partner place the patient on a backboard. You are actively assisting with ventilation while your partner is taking baseline vitals. ALS has arrived and the paramedics just entered the building. All right, so they just opened the doors or barely entered the building. As the lead EMT, what should you do? Okay. Letter A. Instruct your partner to stop vitals and take your role while you head towards and speak to the paramedics. So in this case, you're basically telling your partner, okay, stop what you're doing, grab my BVM, and I'm going to head over there to the doors and I'm going to talk to them. This is wrong. You might think this is okay because you're still making sure the ventilations are given. Yes, you didn't stop ventilations, but Both of you guys are still actively doing something. Your partner is still taking vitals, which is important because that's part of your documentation and information for patient care, and you're still handling your own stuff, your BVM, so you shouldn't be stopping anything at all. B, promptly head towards the paramedics and lead them to the patient. Okay, B basically says you're dropping your BVM entirely and walking to the paramedics. Instantly, automatically wrong because no one's giving him ventilations, right? And D, instruct your partner to stop vitals to help lift the patient. So in this case, again, you've just dropped your BVM. That is also incorrect. So that's why C is correct. Continue doing what you're doing and wait for the paramedics to come to you and the patient. As we mentioned during the training session on sim day, basically how you're supposed to coordinate with ALS is keep doing what you're doing. You've already called them, and if you aren't prepared, you aren't ready to take the patient out, stay where you are. They will come to you because they have a gurney. Remember, they're going to come with a gurney. They're going to come with their cardiac monitor, everything else they're going to need before they pick you up, or as they come pick you up. So they're going to be prepared to load and go, all right? No matter where you are in the facility. They're not just going to come empty-handed, all right? You do have the patient on the backboard, so that's convenient, right? You can help transfer the patient easier that way. Make sure you wait for the paramedics. Once they arrive, the situation's under their control, and then that's at the point when they'll tell you what to do and what not to do, all right? Number 17. You arrive an adolescent patient who is actively having a generalized seizure on the ground. Okay, that means the patient is pretty much twitching and having muscle spasms, that kind of stuff. What is the first thing you should do? Okay. Patient's having a seizure on the ground, all right? And you just got there, that's what you see. Request ALS. Obviously, okay, you're going to request ALS because you don't know what caused that seizure. And you don't want to waste time, you don't want to risk it. Even if it's a typical occurrence, that person has a seizure every other day, make sure ALS is called because we don't know if it got worse. We don't know if it's a new seizure. Maybe the patient never had a seizure before. That could indicate something, an underlying life threat that could be going on that needs to be diagnosed by a physician. We don't know, right? So request ALS. Also, and okay, this basically just says that you're going to say the age, gender, blah, blah, blah. So this is just an elaboration of request ALS, right? So that's the first thing you do. B, ensure the area is clear and head undamaged. Yeah, that's important, but you forgot that, this is basically the beginning of your treatment and your assessment, right? You're basically starting to care for the patient at this point. That's, you totally left out the part where you need ALS there because you already realize there's a seizure going on. You can visibly see a seizure. It's not a matter of suspected seizure at that point. That looks like a seizure. So make sure ALS is called regardless before you do anything else. Or have your partner call ALS while you take care of the patient and you ensure that the area is clear and head undamaged. Make sure ALS is requested first. And C, prepare the handheld suction device. D, prepare the oxygen. So basically, think of this as, you see the seizure patient and the first thing you do is flip out your suction or your oxygen. That's the first thing you do. Both are wrong because first of all, that's not how you treat someone to begin with. You totally forgot about your assessment and, figuring out what's wrong with the patient, first of all. And you haven't even gotten up close and personal to that seizure patient yet, so you don't even know if there's suction to be required. So that's why ALS is important first. Number 18. Your patient may exhibit all the following signs during the postictal state, except muscle spasms. That's exhibited during actual active seizures. Postictal states are characterized by weakness, lethargy, flaccid muscles, confusion, disorientation, labored breathing. That falls under the category of postictal state, the state after the seizure. All right. Number 19. You should be able to distinguish TIA, transient ischemic attack, from CVA or cerebrovascular accident, because your treatment will differ depending on the condition. That is false. Why is that false? Because they will have similar signs and symptoms. You're going to see similar things. right? Although, TIA is a minor, less dangerous form of CVA, you still don't know. Externally, you're not going to look at a patient and say, oh, that's a TIA, oh, that's a CVA. No, you have no idea. You're just going to see what you see, so you must treat appropriately. So your treatment will not differ, because you might see facial droop, hemiparesis, you might see something that falls under the category of stroke, and it could be either, right? So you don't know. That's why it's false. Number 20. According to OCMS protocols, you may suspect ischemic stroke, or ischemic stroke is that lack of blood flow. The opposite, the other stroke is going to be your hemorrhagic, which is basically bleeding out in your brain. But we're talking about ischemic stroke in this case, right? So you may suspect this type of stroke if the patient has a GCS score of 10 or over, onset of stroke symptoms occurred within 7 hours before the incident, and one of these. Okay, so unilateral arm drift. So this is your arm in your FAST, right? Your FAST acronym. B, facial droop, right? That's your F in your FAST. Slurred or unintelligible speech. That's your S in your FAST. And your unilateral loss of grip strength. So this will fall under your arm drift. Basically, the weakness, ataxia, muscle coordination is not on point. And that's unilateral, right? You just need to show any one of these to count as a suspected ischemic stroke, right? Again, this is an obvious answer, because this arm drift will count, right? If you see arm drift, that's probably a stroke. If you see facial droop, it's probably a stroke. Given those two options alone, any one of those are options, right? Therefore, E is correct. Any of the above. 21. You arrive at a male adult who is choking. Your treatment will be to, okay, let's jump straight to the answer here. Request consent. Hey man, I'm an EMT, can I help you out? And then give 5 back slaps, 5 abdominal thrusts, then repeat. Okay, back slaps first, abdominal thrusts second. Okay, in that order, and then repeat. Okay, the other options are wrong. But take a look at A. A says give 5 chest thrusts. That's incorrect. Okay, chest thrusts are for your infants, right, with your 2 fingers, and for CPR. And chest thrusts are also for your pregnant females. Okay, you arrive at a male adult. Odds are this male is probably not pregnant. Therefore, 5 back slaps, then 5 abdominal thrusts. 22. Which of the following statements about choking management is incorrect? A. When you treat an infant, you should be seated and straddle the infant on your forearm as you perform back slaps. Okay, that is a correct procedure, so A is not correct. A is not an option. We're not going to select A. We're looking for the incorrect procedure here, okay? So, B. When you treat a child, you should not place the child on a sturdy table or chair to allow you to perform back slaps and thrusts effectively. What I mean here is that you have a kid, little kid, probably 10 or 12, shorter than you, so you think it's a good idea to put that kid on a chair to do your back slaps and thrust effectively because the kid's too small? No, incorrect. Remember, as we talked about in training, you kneel down to their level on your knee or whatever you have to do. Make sure you kneel down and treat that way. Back slaps, abdominal thrusts, repeat, that kind of thing. Don't put them on a chair. Don't put them on a table. That increases the risks of them getting injured, and that's not good for you. All right, so that's why B is correct, because it says here that when you treat a child, you should not place them on a sturdy chair or table, right? So that means this statement is correct, but we're looking for the incorrect statement, right? D. When you treat an adult, child, or infant, you should obtain consent before treating. That is also a correct statement, so we're not going to select that. And C. When you treat an infant, you should administer back slaps using your fingers only. This is the incorrect statement, because when you administer back slaps to an infant, you administer using your heel, the heel of your hand, okay? Refer to the PowerPoint, and we talked about this during the training session. 23. Security says over the radio, hey, we need a medic over here in section 104. A man just collapsed in his seat less than a minute ago. So you confirm receipt of the call. which of the following next actions is inefficient, all right? Inefficient with your time. A, take your gear bags, wheelchair, stair chair, AED before being en route. No, that looks pretty efficient because you're grabbing the AED and heading out. B, take your gear bags, wheelchair, etc., and then tell the nearest security guy to grab the closest AED and meet you at section 104 ASAP. That sounds pretty good too, because you're still considering that the AED needs to be there ASAP, right? You're still considering that you have to bring the AED with you because there's a guy that just collapsed in his seat. Could be a heart attack. You won't know, and you don't want to take that chance. And D, take your gear bags, etc., and grab the AED while en route. So basically, you're grabbing your stuff, you're heading out, and before you get to the section, you quickly open up the container or you grab one of the AEDs available and take that straight to the patient. That looks pretty efficient too. And C, this is not efficient because you are taking your gear bags, wheelchair, etc., and you're heading to the patient first. You're basically getting to the patient, and after confirming that there's cardiac arrest, you delegate for someone else to get the AED. Okay? This is not efficient because you are wasting precious time. Okay? The AED should be there already. And also, think of it this way. This is also basically how layperson civilian CPR works, right? They get to the person who collapsed, they check for cardiac arrest, pulses, apneic, and then they call 911 and get someone to get an AED, right? That's what someone probably already did, and they're just waiting for the AED to show up, right? And if you show up without your AED, they're looking at you like, what happened? Where is the AED? So make sure you get that AED over there ASAP. A, B, and D correctly cover that. And C does not. So that's why C is the correct answer. 24. When giving ventilations, using an inappropriately sized BVM or a CPR pocket mask is permissible. Allowed. False. We are going to have pediatric and infant BVMs in our gear bag. Using the wrong one when you have all the gear is not good because they are built differently. Otherwise, we would just use the same equipment, right, for everybody. You have different volumes of air in different bag sizes, right? So we aren't trained to use adult BVMs on children, okay, because we've never done that before. Our training does not cover that information, and it's dangerous for the patient, okay? 25. Your partner has begun compressions on a pediatric patient undergoing cardiac arrest. Okay, so you have derobed the patient's chest, and you open the AED unit, and you notice that the adult AED pads are attached to the unit, the adult AED pads, okay? You should, so here's the problem. We have adult AED pads available, but you have a pediatric patient. So what do? So, B, use the adult pads in an anterior-posterior pad placement. So, basically, this is not incorrect, okay? This is not completely incorrect. This is what you do if you only have adult pads to use, right? Anterior-posterior. That is correct. So let's leave that for now, okay? Discard the AED and only assist with ventilations. Discard the AED. Okay, so C and D, before we even read the rest of this problem, or the rest of the options, you can mark these down. Mark these off. Reason, you don't discard the AED. You have the AED, and if it works, you use it. All right? Don't discard it, no matter what. And so let's take a look at A. Quickly inspect the bag for pediatric pads before attaching the adult pads in an anterior-posterior pad placement. Okay. In our training, we covered that most AED units will have a compartment that holds pediatric and infant pads. And it doesn't take that long to slap it open, flip open the maybe like a cover that's hiding it, and see that there are other pads available for you to use. That's why you quickly inspect the bag for pediatric pads before attaching adult pads. And that's why B is wrong, because you're basically jumping straight to the adult pads without even checking for pediatrics, right? And that's, the whole point the whole point why manufacturers put pediatric pads in the AEDs is for you to use them if you have a pediatric patient, right? So make sure you check the bag real quick before attaching the adult pads. And if when you inspect the bag for pediatric pads, if you see them, obviously you're going to use them instead. Switch it out, okay? Alrighty. So that's why that's the correct answer. Alright, so that's the end of the Winter 2018 DEM 2 written component walkthrough. I hope I answered a lot of your questions about some of the answers you probably got wrong. But if you have anything in mind or any questions that you might have, feel free to let me know through email or a direct message, and I'll be glad to answer. Other than that, thanks for listening. See you next time.